You can certainly see the emotion in Dr. Hoops today, and it's been a lot for everyone, especially those in the medical and mental health fields. You heard him say we have some work to do going forward. So let's talk about going forward. Focus on what we hope is a much brighter future. Earlier today, Joe Paris checked in with leaders of the St. Luke's Health System for their perspective about what they see in their COVID crystal ball. While we're still knee-deep in it, they say there are reasons to be hopeful that we are going to walk out of this to much better times, sooner rather than later.
Today in particular, I feel very hopeful that we are really on a good trajectory.
A trio of chief medical officers for the St. Luke's Health System took some time Friday to reflect on what has been a challenging time since COVID-19 was first reported in Idaho. Dr. Frank Johnson says it's incredible how far we've come since this day 1 year ago.
We had patients who were afraid, we had staff who was afraid, and a year later we're in a position of hope, and that's remarkable. What a journey. I'm so grateful that we've been able to get to this point.
As many look back on the last 12 months, Dr. Michaela Schultz is also looking forward. The future to her is filled with more learning about the virus and ourselves. For her, that brings hope.
It's important for us to also understand what is yet there to learn and realize. To me, that is part of the hope that we continue some growth journeys, and we've found some gaps and things that we can continue to optimize.
The future is filled with unknowns as people wonder when things will be more normal. Dr. Schultz says, of course, no one can say for sure, but there is reason to be optimistic about the not too distant future.
We've heard on national level yesterday announced that there's good sense that maybe in the midsummer we will be moving towards that where we can gradually change. I think much will depend on how the virus and the variants will evolve, how effective the uptake of the vaccine will be, as well as obviously the supply. And I really just strongly encourage people, to take that view that things will, every week as we're going through this, we will have more clarity when that will be the case.
Dr. Johnson says this past year has shown the importance of neighbors taking care of each other. His hope for the future is based on communities reconnecting in person, something that once seemed so far off, now back in sight.
And that's what I'm really excited for. So over the next couple of months, we will be able to come out of our bubbles. We might have to rebubble again for short periods of time, depending on how things go. We don't know. But as we emerge, I'm just, again, optimistic that we can take that opportunity to reframe the discussion with our communities.
The future holds plenty of difficult discussions as well. Dr. Joshua Kern says it's been very difficult to see so many conspiracy theories about the virus and medical community over the last year, while frontline healthcare workers have battled the virus. Hope for the future hinges on our ability as a community to recognize the truth and move away from dialogue that has made fighting the pandemic more difficult.
We have to get back to the point where we say, no, really, this vaccine has been given to tens of millions of people in the United States. It's showing to be very safe. It doesn't cause insert conspiracy theory there. And people say, okay, great, let's get this vaccine because it's safe and it prevents this virus, which has killed more than 1 in 1,000 people in the United States.
While the future is still unclear, this trio is optimistic that yes, better days are ahead.
The trajectory right now is really pointing in that direction of us getting back to those in-person gatherings and gradually being able to reduce the things that we have to wear and the cautions that we have to take.
And for months, we've seen and heard your comments about how can we speed this up? How can we get to more normal times faster? And the medical community has been very clear all along. When available, get that vaccine. And Brian, until you get that vaccine, the CDC and all medical professionals are encouraging people to continue to wear a mask, continue to physical distance, and keep up those good hygiene habits. I know it feels like for some people that this is over, but Brian, the virus is still out there.
Yep. And Joe, we could have honored this day without looking back, but you have to appreciate the look forward, and it does look brighter to us from here. So thank you very much.